Okay, people ask me, which one is artery, the blue one or the red one? Look, it's blue here, red, blue, red, blue, red. So what's that? Actually, this is a Doppler device, and here we have a mark. It says if the blood is going towards the Doppler, this is where I put the Doppler. If the blood is going towards the Doppler, it is blue now, this one. If the blood is going away from Doppler, it is red in color, okay? So both is artery, and I can change this color. Now it become red, the blood coming through the device is red, the blood going away from the device is blue. I will change it again, so it become changed, they become changed. So this is all artery. These arteries have a shape like this, like a zigzag. So here it is blue, then red, then blue, then red. All of them is artery. So what we look here, if is there any damage in the arteries, and I can say, yeah, in the testes we have good blood is coming into the testes. So you are very important for me. You are a primary case. You didn't have any operation before, right? No, this is because people usually don't make too much research, and when they are operated and they have a recurrence, they make the research and they find me. But you find us before you have any surgery. Why you make the research? What was your concern, and why did you do these researches? What was your point?
Well, I think it's because it's so important. It's
how you understand that it's important disease, or because it's a simple. Normally doctors say, oh, okay, it's varicocele, come, it's 15 minutes operation, nothing to worry about. And you had a huge vein. What was the concern? I'm sure there was something that couldn't fit in your mind. You didn't like the decision, or what was your concern?
I think for me the biggest concern was because again, it's such an important and sensitive part of your body, and
Yeah.
you want to make sure that you have the best surgeon to do it, and you obviously want to find out as much information as you can before you go for the surgery and before you choose where you get.
Okay, I can see that your disease at the beginning was a little confusing. You have this epididymal swelling pain. What was it?
I didn't really get a proper diagnosis at the start. I went to 3-4 different doctors. 2 of them were specialists.
What was your main complaint at the beginning when you go to doctor?
The main complaint was that my scrotum, my testicles scrotum area was in pain.
Yeah.
And I felt.
Is it in the left side?
It was actually both. When it started, I felt both. As in, I felt I couldn't pinpoint exactly where the pain was. So it was coming from the full scrotum. So I felt the scrotum was in pain.
Did you understand? Your vessel was huge. Yeah, I mean your left vein.
But that's.
Did you understand? Oh, there is something swollen here.
No, but I didn't understand at first because I do not know about the disease. Men usually don't talk about. So I don't know any other guy, and I had a friend who've gone through this.
Yeah.
So for me, the veins that I already had on the left side.
You live in Ireland, right?
Yes.
Ireland, yeah, and you are working on computer, right?
Yeah.
Mainly sitting.
Yeah.
Yeah. So normally we think it is a disease of men standing up, working all day in the. For example, my last patient was a barber. He is always standing up, but also I think this sitting position, this kink in your body, always you are in 90 degrees angle, your legs and your body. It's also making some discomfort for the varicose veins. So you had the pain in the scrotum, both sides first.
Yeah, it was both sides first. I was feeling a sensation kind of warm, so it was kind of in pain, warm, and it was 24 hours for me. Like it was all the time. It wasn't going away.
Yeah.
I also had some spasms on the left side from time to time, and the veins were moving more often, and not because of the temperature change, but my scrotum was. I could see that it's.
This is right side.
Okay.
Okay, let me finish the bandage change now and then talk about your story more because you will get cold with this. Now you look, well, right side, there is no varicocele, this is sperm port, this is artery and the veins are around the artery. And left side now, of course, it is more swollen, but we don't have any residual veins big. Artery is here, let's change the color to red. Previously you had this huge, do you remember the view before the operation?
Yeah.
A huge vein.
Yeah.
And yeah, it was mainly two veins
I can
in the
feel them
outside, turning, twisting
Yeah.
around the testicle. We take it out, and inside also a big one, and little ones too. Yeah, so let's change the bandage and talk more. Yeah, let me show your intraoperative video. Okay, here we see an external vein which is huge, and we dissected nearly 30 centimeters of vein. There are a lot more veins, some of them may be internal, some of them may be external. So this external, first external vein was easy,
out and we'll work on the other
and
veins.
we dissected this.
Okay,
And this is
now
the second vein.
vein. Yeah, it's very rare that we find two big external veins. This is maybe around 20 centimeters.
Yeah.
So
I
totally
think-
maybe 50 centimeters. This is maybe around.
Okay, here, from here to my tip, this is 15 centimeters. I know it, I measured it before. So it is around 20 centimeters, and the previous one around 30 centimeters. So 50 centimeters of vein we dissected out. Of course, after the procedure, the dissected places, there is edema, swelling in these parts. So you have a little more swelling compared to others, but this is not abnormal. Sometimes we scare from bleeding after the procedure. It may happen too. If this happens, we just compress the scrotum for 1 week maybe. And when it bleeds, it takes maybe 1 month to turn back to normal. But it doesn't need a second procedure, second operation. It's just you heal by compressing. So these are the veins.
And 20 centimeters. So totally maybe 50 centimeters of veins extracted. Okay. Okay, now.
Okay, you had the cysts.
Two cysts here.
Actually, you are very lucky, my friend. We can take out a lot of veins, and there are many people. For example, with you, there was another guy from US. He also had cyst, but I couldn't find it in the operation. You had the same big, same large cyst, and when I opened the testicle, I see immediately the cyst just. What's so just near the testicle, they were just coming to hit to my face very easily. And in the other guy, I couldn't find them. I can't dissect. So you warned me before the operation. You said, "Hey doctor, I read if you work too much with the cysts, you can give harm to spermatic channels." This is very true and correct. So we don't fight too much with finding these cysts. They are small. They will just give no harm. But if we find them, we love to take them out.
Here, small, and one more here. So 3 cysts.
So actually
They
it
are
was 3
simple
cysts.
to remove.
Yes,
So
you
we
see
will,
one
remove
very
them easily.
next to each other.
Okay, now we are.
Yeah, this device is very important. So everybody has concern about the taking the veins out. This seems to be the most different part of our procedure. But I think that one of the most important things is finding the arteries in the operation. Because for a urologist to be comfortable with the procedure, you have to be sure that you didn't give any harm to arteries. It is possible. In all my operations, still I am very scared of this. Even I see the vessels, in every ligation, resection, I control the artery, and it is a very important device.
Looking for
Microvascular Doppler device.
Artery is here, and we are removing an internal vein.
So after this 50 centimeters of external veins, in the internal spermatic cord, internal veins, you had also huge veins.
It is maybe 8
If you
centimeters.
don't take it out like this,
7
today
centimeters,
I would see this vein inside, and we would wait for the disappearing of this vein. So we take it out. I am happy.
Vein, it is just next to artery, so we will ligate it, and we are getting this out. Yes, finally,
Okay.
we removed enough.
So these are your initials. We don't say your name. Nobody can understand. I hope this. Do you want us to delete this part?
No, it's fine. It's okay.
Thank you.
Veins.
Yeah. So this is our cyst, and we have actually 3 cysts, but the other 2 is very small. But this one came out completely, and yeah, we are happy. The procedure is finished nicely. So after the procedure, of course, it is tricky. It's not very comfortable. It will take some time for you to heal completely, but it is doable. It's manageable. Last week, I think we operated 4 persons from other countries. It's okay. It's possible, and you will manage it too. We will be in touch. We will be in contact. We will help you during the healing, recovery, and as you said, your diagnosis was a little difficult because of pain. They didn't recommended you the operation maybe in 100%. What was the story? Say again, please.
One of the doctors thought that I had epididymitis,
Yeah, epididymis.
and I was given medication, mainly antibiotics, for maybe a week.
So
and
because you had the pain there,
yeah,
you feel the epididymis is swollen, but these are all because of these large veins. I hope. I think. Then
and then it was a local doctor, so he said that after a week of antibiotics, when the symptoms did not go away, that he thought that I needed to see a urologist specialist. And I saw one, and he seemed to think that it was orcalgia, that it was pain related to some unknown cause that he.
So were they? Yeah. First time I examined you, is when you open the testicle. I said, "Oh, what's that?" It's very obvious. Why they have concern about? They didn't think it is varicocele. Why? What's your opinion?
I don't know. I mean, the only thing I can think of is maybe they didn't come across a lot of these cases, because I had a.
Do you think it gets more and more after their examination? Is it getting worse? Because it's really
No, it was actually worse before I came to your
Really?
came to your clinic, because I also got ultrasound done, and the radiologist in the report
And it's
confirmed,
also they
they confirmed that it was a
bigger than 4 millimeter vein, right?
the radiologist said that it was up to 3.5 millimeters, moderate level of varicocele, but the urologist said that he didn't believe that it was significant, that it was after taking medication, a few months, the pain and the symptoms will go away. And I ended up seeing 2 other specialists just to make sure, because I was concerned, and also because there was contradictory information from the radiologist. The radiologist is saying that it is moderate level of varicocele, whereas the urologists seemed to think that it wasn't big enough.
Did he make the examination in standing up position?
Standing up and laying down. But
Urologist.
The urologist, I think, I laid down actually. I laid down when he examined me, and I saw another 2 urologist specialists after doing some more research, and they both confirmed that it was grade 3 level varicocele.
So do you know what grade 3 is? Grade 3 is, if it is
You can
visible.
visibly see.
So, and you know it's visible. You can easily feel the difference, see the difference. It's from outside. Yeah, it was big. 50 centimeters of vein came out.
Yeah.
Actually, this may be an issue because you had 2 very long veins side by side. One of them was more thicker. One of them was thicker. One is 20 centimeters. It was a little shorter. Maybe when they are side by side, maybe I measured, but I measured them really. Let me show you the picture. So, Arjan, before the procedure, this is really 4.1 millimeter vein. We see it together, and it is really huge. This is the shortest one.
Yeah, the shorter one was.
Why they think it is not significant, I really have no idea. Maybe sometimes it may change. Maybe in Ireland, maybe it's a cold environment and the vein was smaller. I have no idea. What's your opinion on it? Why didn't they diagnose?
I think the biggest reason may be because you physically examine the patient and you also use the Doppler, the ultrasound Doppler device, the color Doppler, and in Ireland they don't do that. Radiologists is a separate department, and
all over the world, urologists are not using this, but they will use it in a short time because it's really helping too much before the operation and after the operation. And you had this reflux just immediately without straining, without doing any exercise. Yeah, so it's the diagnosis for me 100%. I'm sure that it's the problem. And about the cysts, they are really unimportant. What was your concern about? What did you think about them?
Well, my concern was from the research that I was looking into for smaller cysts, because I think they were up to 6 millimeters, and the concern was that removing those cysts can harm the epididymis, which can have future repercussions on how the sperm.
Thank you for sharing this. It's very important. Yeah, really, people sometimes push us. Hey, doctor, I have a cyst. Please remove it. Yeah, if it is buried inside the epididymis, trying to take it out will damage the sperm channels. So when it gets bigger, it's easier to find it because it comes out of these sperm channels. But when it is small, it is not easy to take it out. You had by chance very easy position, so we removed that, your cysts, but sometimes we cannot touch them. Yeah, thank you for this comment too. And what about the healing is always tricky, especially at big veins. If the 50 centimeter vein is coming up, 50 external veins, and maybe nearly 8 to 10 centimeters internal vein, a very big dissection means too much edema, too much swelling. Tell me about be honest, don't try to cover me. Be honest about the healing time. How was the recovery? For 3 days now? No, 2 days.
No, 2 days.
2 days.
Yeah.
After 2 days, how do you feel?
I'm not 100% sure because yesterday I was in a lot more pain. On the day of the surgery, for me it was slightly different, I guess, because I was feeling pain in my back for the anesthesia that we tried in the back, and also my throat. But I didn't feel as much pain in the groin area at the time. It could be because I was on medication.
And anesthesia, we give local anesthesia, everything. Yeah. So
but it's,
then yesterday, but after the first day was more painful.
Yeah. So the next day I felt more pain.
This is second day now.
This is the second day, yes.
Yeah. Usually I can say, okay, so if the patient is in too much hurry, he has to turn back to his home as quick as possible. Of course, it's not very enjoyable, but even at the second day, it's very difficult, but it can be done. You come to my office walking, and I said, oh, you are not walking like a penguin. People usually walk like penguin. You are, but you have discomfort, of course. But still, it's possible to go to travel today too, but not. I don't recommend.
Yeah, I think I can. For me, I've been, because I was walking even yesterday. I went to nearby, mall just to get some fresh air. I was able to do that. I just don't know what other people, like you were saying, that the people could be worse.
I don't want you to walk around all the day sightseeing, but you can go to something to eat. Something.
That's what I did. I went out
just
to kind of get some.
10 minutes walking is okay. And tomorrow, for example, third day, it's possible. It will be more easy tomorrow. You can travel, but you will travel the next day, right? Tomorrow is Saturday, and you will travel on Sunday.
Sunday morning.
Yeah, and you will fly to Ireland, maybe 6 hours flight.
It's 4.
4 hours. Okay, nice. So to US, to other countries, to very far countries, more difficult but possible. So. Yeah, thank you for coming. Do you have any other questions? I have. Please ask your questions. I will try to answer.
Mostly, I think just right now, immediately, my concern is just how long it might take to recover and for things to go back to normal.
People say 5 days for one-sided varicocele. They say 5 days is enough. You have an extreme varicocele, still after 5 days you can go back to normal table jobs. For bilateral cases, let's say 7 days. To be safe, to be better, maybe a little longer, but next week you will feel much different.
Okay. Yeah, I
And
think
for the sexual activity, for example, we recommend not to have sex for 2 weeks. This is not a rule. This is not written anywhere. What happened if you do it? One of the guys, I said, let's try it, and he had too much swelling. So I said, okay, 2 weeks is good. I don't know why, because there is no relationship with the sperm coming from prostate gland and the seminal vesicles, which is far away. But still, if maybe there is too much blood flow to testicle, so I don't recommend for 2 weeks. For sportive activities, for weightlifting, such things, yeah, in Turkey I am making Doppler control after 1 month, after 3 months. So for patients abroad, I recommend not to do anything for 4 months. For heavy lifting sessions, just you can walk, maybe jogging, like a little running. Swimming is all possible, but for heavy liftings, just wait for 4 months. After 4 months, have a Doppler, ultrasonography again, have a sperm count, send them to me, and we will let you do such things. Yeah, you can ask more, but this is enough for recording. Thank you very much for joining us and letting